Welcome to our channel. Today, we're diving into a crucial topic, the early signs of heart disease. We're going to cover 9 of them today. Recognizing these signs early on can be absolutely life-changing. Remember, I'm here to give you the information, but I can't stress enough how important it is to talk to your doctor about any health concerns you have. Let's kick things off with the most well-known sign of heart trouble: chest pain. It can feel like pressure, tightness, squeezing, or even a burning sensation. When the arteries that supply blood to your heart muscle get narrowed or blocked, that's when you start experiencing chest pain, especially during physical activity. This pain, often called angina, is your heart saying, "Hey, I'm not getting enough oxygen here." The location of the pain can vary too. It can be centered in your chest, radiate down your left arm, or even move up to your jaw, neck, or back. Sometimes it can be mistaken for heartburn or indigestion, but it's always better to err on the side of caution. Not all chest pain means you're having a heart attack. Anytime you experience it, especially if it's new, unexplained, or accompanied by other symptoms, you need to get it checked out ASAP. Early detection is key when it comes to heart health. All right, let's talk about shortness of breath, or dyspnea. If you find yourself struggling to catch your breath even at rest, it could be a sign that your heart isn't pumping efficiently. The heart pumps oxygen-rich blood to your body, and your lungs take in oxygen and get rid of carbon dioxide. When your heart's not working properly, it can't pump blood as effectively, and fluid can back up into your lungs, making it harder to breathe. This can manifest as shortness of breath, wheezing, or even waking up gasping for air in the middle of the night. Shortness of breath can be caused by a lot of things, from asthma to anxiety. But if it's new, persistent, or getting progressively worse, especially if you have other risk factors for heart disease, it's crucial to see your doctor. They can determine the underlying cause and recommend the right treatment plan for you. Now, we all feel tired from time to time, right? Life gets busy, we work long hours, we don't always get enough sleep. But if you're constantly feeling exhausted, if even simple tasks feel overwhelming, and you're experiencing a level of fatigue that's out of proportion to your activity level, it's worth considering heart disease as a potential culprit. When your heart isn't pumping efficiently, your body isn't getting the oxygen it needs to function properly. This can lead to a feeling of overwhelming tiredness and fatigue, even after a good night's sleep. Fatigue is a very general symptom and can be caused by a whole host of things, from thyroid problems to vitamin deficiencies to depression. But if you're experiencing unusual or persistent fatigue, especially if it's accompanied by other symptoms like chest pain, shortness of breath, or swelling in your legs, it's essential to talk to your doctor. Let's talk about swelling, specifically in your lower extremities. Swelling in the legs, ankles, or feet can be a common issue that many people experience at some point in their lives. It's normal to experience some mild swelling in your legs and feet after standing for a long time, especially in hot weather. This type of swelling usually goes away after some rest and elevation. But if you notice persistent swelling, especially if it's accompanied by other symptoms like shortness of breath or fatigue, it could be a sign of heart failure. This is a more serious condition that requires medical attention. Heart failure doesn't mean your heart has stopped working altogether, but it does mean it's not pumping blood as efficiently as it should. This inefficiency can lead to a buildup of fluids in various parts of your body. When this happens, fluid can build up in your body, particularly in your legs, ankles, and feet because of gravity. This fluid retention can cause noticeable swelling and discomfort. Swelling in your legs can also be caused by other things like kidney problems, varicose veins, or even certain medications. Each of these conditions affects your body differently and can lead to fluid retention. But if the swelling is new, persistent, or if you press on the area and it leaves a dent that stays for a while, we call that pitting edema. It's crucial to get it checked out. Pitting edema can be a sign of a more serious underlying condition. Your doctor can determine the underlying cause and recommend the right treatment plan for you. Early diagnosis and treatment can help manage the symptoms and prevent complications. Now let's talk about your heart's rhythm. Your heart's rhythm is crucial for maintaining overall health and well-being. We all know what a heartbeat feels like, that steady thump-thump in your chest. It's a comforting and familiar sensation that we often take for granted. but sometimes you might notice your heart skipping a beat, fluttering rapidly, or pounding in your chest. These unexpected changes can be alarming and unsettling. These sensations are known as palpitations, and while they can be harmless, they can also be a sign of a heart condition called arrhythmia. It's important to understand the difference. An arrhythmia is basically an irregular heartbeat. It can manifest in various forms, each with its own set of potential risks. It means your heart is beating too fast, too slow, or with an irregular rhythm. This irregularity can affect how well your heart functions. While some arrhythmias are harmless, others can be serious and even life-threatening if left untreated. It's crucial to pay attention to your symptoms. Occasional palpitations are common and often harmless, especially if they're triggered by stress, caffeine, or exercise. These triggers can usually be managed with lifestyle changes. But if you experience frequent, persistent, or bothersome palpitations, especially if they're accompanied by other symptoms like dizziness, shortness of breath, or chest pain, it's essential to consult your doctor. These could be signs of a more serious issue. They can perform tests to monitor your heart rhythm and determine if the palpitations are a sign of a more serious underlying condition. Early detection and treatment can make a significant difference in managing heart health. Let's talk about two symptoms that often go hand in hand: nausea and lightheadedness. When these symptoms occur persistently or are accompanied by other warning signs, they can indicate a problem with your heart. When your heart isn't pumping blood effectively, it can affect blood flow to your brain and digestive system, leading to feelings of nausea and lightheadedness. These symptoms are non-specific and can be caused by a variety of factors, including dehydration, low blood pressure, or even anxiety. But if you experience sudden or persistent nausea or lightheadedness, especially if you have other risk factors for heart disease, it's important to seek medical attention. Your doctor can help determine the underlying cause and recommend the appropriate treatment. Remember, it's always better to be safe than sorry. Early intervention can make all the difference when it comes to heart health. All right, let's talk about coughs. We all get them from time to time, right? It's your body's way of clearing irritants from your airways. But did you know that a persistent cough, especially one that produces pink or white mucus, could be a sign of heart trouble? When your heart isn't pumping efficiently, fluid can back up into your lungs, just like we talked about with shortness of breath. This fluid buildup can irritate your airways, triggering a persistent cough. A heart-related cough is often worse when you're lying down because gravity causes more fluid to pool in your lungs. You might also notice that the cough is dry or produces frothy, pink-tinged mucus. If you have a cough that just won't quit, especially if it's accompanied by other symptoms like shortness of breath, fatigue, or swelling in your legs, it's essential to see your doctor. Now, this one might seem a little surprising, but pain in your neck, jaw, throat, or back, especially if it radiates to your left arm, can sometimes be a sign of heart problems. This type of pain is often overlooked because we tend to associate it with more common issues. We often associate pain in these areas with muscle strain or other common issues, like poor posture or overexertion. But it's important to pay attention to your body's signals. Ignoring these signs can sometimes lead to more serious health issues. The heart and other organs in your body share nerve pathways. This means that pain can be referred to different parts of the body. When your heart is in distress, it can send pain signals that travel along these shared pathways, making it difficult to pinpoint the exact source of the pain, causing pain in areas seemingly unrelated to your heart. This is why it's crucial to consider all possibilities when experiencing unexplained pain. Pain in these areas is much more likely to be caused by something like muscle tension, a pinched nerve, or even arthritis. However, it's always better to be cautious. But if you experience sudden, unexplained pain in your neck, jaw, throat, or back, especially if it's accompanied by other heart attack symptoms like chest pain, shortness of breath, or nausea, it's crucial to seek immediate medical attention. Don't wait to see if the pain will go away on its own. Early intervention can make all the difference when it comes to heart health. Timely medical care can save lives and prevent further complications. Let's talk about sweating. We all sweat. It's a natural bodily function that helps regulate our temperature. But did you know that excessive sweating, especially when it's not related to heat or exercise, can be a sign of heart trouble? When your heart is working hard to pump blood throughout your body, it can trigger your nervous system to go into overdrive. This can lead to excessive sweating, even when you're not physically active or in a hot environment. If you experience sudden, heavy sweating, especially if it's accompanied by other symptoms like chest pain, shortness of breath, or lightheadedness, it's crucial to seek medical attention immediately. These could be signs of a heart attack, and every minute counts in these situations. Don't hesitate to call 911 or your local emergency number right away. So, we've covered a lot of ground today. We've talked about 9 early signs of heart disease that you should never ignore. If you or someone you know is experiencing any of these symptoms, it's important to consult a healthcare professional. Don't forget to like, share, and subscribe for more health tips and information. And as always, thanks for watching and stay healthy.